A cat will hide illness from you for as long as it physically can. This is not stoicism. It is instinct. In the wild, a small predator that visibly limps becomes prey, so cats evolved to conceal weakness until concealing it is no longer possible. Which means that by the time your cat is obviously unwell, the problem has usually been developing for a long while already. That one fact should change how you look after a cat. You cannot wait for symptoms. You have to watch for small changes and take them seriously. Welcome to Pet Care, the channel where we take the guesswork out of looking after the animals who share your home. Today we are covering how to care for a cat properly. And I want to say at the start that cats are not small, quiet dogs. Almost everything about their nutrition, behavior, and medical needs is different, and most owner mistakes come from applying dog logic to an animal it does not fit. One note first. This is general guidance, and your vet knows your cat where I do not, so where this video and your vet disagree, listen to your vet. Let's start with food, because cats have stricter requirements than almost any other companion animal. A cat is an obligate carnivore, meaning it has lost the ability to produce certain nutrients internally and must get them from animal tissue. Cats cannot thrive on a plant-based diet, and that is not a philosophy, it is metabolic. The clearest example is taurine, an amino acid cats cannot synthesize in adequate amounts. Deficiency causes a form of heart disease called dilated cardiomyopathy, and degeneration of the retina leading to blindness, and both can be irreversible by the time they are noticed. This is exactly why you must not feed a cat dog food as a regular diet. An occasional stolen mouthful is not an emergency, but dog food is formulated for a different animal. Cats also need more protein than dogs. So the practical advice is simple. Feed a complete and balanced commercial cat food suited to your cat's life stage, and look for a statement on the packaging confirming it meets a recognized nutritional standard. That sentence matters more than anything on the front of the box. Now hydration, which is the most underrated topic in cat care. Domestic cats descend from desert-dwelling ancestors and carry a weak thirst drive as part of that inheritance. In the wild, a cat gets most of its water from the bodies of the animals it eats, which are around 70% water. A cat eating only dry kibble is getting food that is about 10% water, and many cats do not compensate by drinking more. The result is chronic mild dehydration, and it is strongly associated with two of the most common problems. Causing tremors and seizures. This kills cats every year in households where someone applied the dog's treatment to the cat, or litter tray problems are among the most common reasons cats are given up, and most are solvable once you understand what cats want. This can be off-putting. Scoop at least once a day, because a tray that seems acceptable to you may not be to an animal with a far better sense of smell. And here is the rule that matters most. If a cat that has always used the tray suddenly stops, your first call is the vet, not a behaviorist and not a search engine. Inappropriate urination is one of the primary ways cats signal urinary tract disease, cystitis, kidney problems, diabetes, or arthritis, making the tray hard to climb into. Assume medical until a vet rules it out. Which leads directly to the single most urgent emergency in cat ownership. If a cat, and this is far more common in males, is straining in the tray, going in repeatedly, crying while trying, and producing little or no urine, that may be a urinary blockage. The urethra becomes obstructed, urine cannot leave the body, toxins build up, and the condition becomes fatal within roughly 1 to 2 days. It is frequently mistaken for constipation. This is back and shoulders, and deposits scent as a territorial marker. A cat will scratch. Your job is deciding where. Never resolves. If you use one, finish by landing the dot on a physical toy the cat can grab. Occasional hairballs are normal, but frequent retching is not. Trim claws every few anything is found. Keep up parasite prevention suited to your region, using cat-specific products only. Cat is indoors, the enrichment we discussed is not optional. If your cat goes outside, since hiding is a primary pain signal. Weight loss, increased thirst, or increased urination, which are classic early signs of kidney disease, diabetes, and hyperthyroidism. Also, repeated vomiting, difficulty jumping, or reluctance to use stairs, which usually means arthritis and is badly underdiagnosed in older cats, and a visible third eyelid across the corner of the eye. Do those things consistently? Feed properly, keep water intake high, get the litter trays right, give your cat height and hiding places and something to scratch, and take small changes seriously rather than waiting for obvious symptoms. A cat will not tell you when something is wrong. Noticing is your job, and it is the most valuable thing you do for them. If this was useful, please give it a like and subscribe, because we have episodes coming on kitten care, introducing a second cat, senior cats, and decoding cat body language. Tell us in the comments what you would like us to cover next, and what your cat's name is, because we do read them. Thanks for watching, and go and check whether there are any lilies in your house.